Welcome, everyone, and thank you for joining us for today's roundtable. My name is Nicole Trimble, and I'm an account supervisor here at SocialFly. SocialFly is a cutting-edge, full-account social media and digital marketing agency. We specialize in social media management, content creation, influencer marketing, and paid media. Our discussion topic for today will be internal medicine, start with the end in mind, as presented by the American University of Antigua College of Medicine. This reoccurring live stream series happens every month where we feature our own esteemed alumni, and we are dedicated to giving you a chance to choose what topics you'd like us to discuss. We really want to focus on these real-time audiences and connect with our faculty and on hot topics and trending events. Going back to this month's topic, that internal medicine, our internists specialize in the diagnosis, treatment, and prevention of disease in adult patients. These physicians are trained to offer the care and prevention of disease in adult patients. They make sure they offer that wide variety of health conditions to make sure they counsel their patients on the prevention and overall wellness. All medical students really consider this specialty as they face an array of different residencies and training choices when they consider subspecialties. We've tapped into two of our AUA alumni today who have proceeded with this medical specialty. They're here to share the opportunities that have been presented to them by choosing to be internists, especially when they're studying at the University of Antigua. But before we get started, we have a little housekeeping. If you have any questions during a roundtable, please go ahead and put them in the comments below. I'll bring them up during the presentation, and we will have a Q&A session at the end. Now, getting to know our panelists, I first want to introduce Dr. Gautham. He's a 2014 AUA graduate who is now starting his cardiology fellowship in New York. Dr. Gautham, please tell us a little bit about yourself and your current experience.
Hi, it's nice to be here with everyone. So my name is Dr. Gautham Upadhya. So yes, I'm currently a second-year fellow, actually at Downstate Medical Center. That's in Brooklyn. And I'm a former graduate of AUA. I graduated in 2014. About myself, I'm originally from New York, okay, I guess technically the Westchester area. So I grew up here. I went to undergraduate. I went in Boston University. From there, then I actually did an MPH. And after that, I decided to pursue medicine. So I found myself at AUA. I actually went to the Manipal campus. That was in India. And then returned here for my clinical rotations and pursued medicine. And that's where I found myself. And I really enjoyed procedures. And I found myself then going towards cardiology, where I am now. So just a brief overview of how everything went. Yeah.
Perfect. Thank you so much. Now we have 2014 AUA Med graduate, Dr. Shri. She is now studying internal medicine, currently practicing in New York. Dr. Shri, please share a little bit about yourself.
Hi, everyone. Good evening. My name is Srilaxmi Gujjula, but I just go by Shri to make everyone's life easier, just like Gautham here. I'm also in downtown Brooklyn. I'm a third-year internal medicine resident at the Brooklyn Hospital Center. And I have a similar pathway just as Gautham. Right after high school, I went into the 6-year program. So I did like 2 years in Manipal and then 2 years in Antigua. And then I rotated different hospitals in America for my clinical rotations as a third year and fourth year medical student. And then ultimately landing in my internal medicine residency here at the Brooklyn Hospital Center. I'm Canadian. For all you that are Canadians as well, feel free to ask any questions. Looking forward to speaking to you all.
Thank you. So first, we're going to start with the pathway to internal medicine. Dr. Gautham, we'll start with you. What did your pathway to internal medicine look like, and why did you choose it as your specialty as a foundation to your current practice in cardiology?
Okay, so that's a good question. So the pathway was definitely not a very straight one. I took a lot of changes. I don't think at all the probably normal expected route. When I started just before internal medicine, I was actually doing economics and then, as I said, public health. And then after that, so I wanted to actually be able to treat patients, and that's where I found myself going into medicine. So I went to AUA. After medical school, then like before, I enjoyed doing procedures, obviously, and in addition to caring for patients. Actually, I applied surgery also with my medicine, so I wasn't quite sure which one I wanted to do. So I applied both. I interviewed for both surgery and medicine programs. And honestly, I got a lot of feedback, different places, different people. And I think, well, everyone has their own opinion, but I thought medicine may have a little bit better lifestyle. Now, I mean, also now that I'm doing cardiology, I don't know, I think the hours may be very similar to surgery, but that was sort of how I ended up in medicine. So it wasn't any one path. I kind of took it as it came, but I'm definitely glad that that's the path I chose and where I am now. So hopefully I can help all of you with any questions, anything you guys have about anything.
Perfect. And Dr. Shri, how did you come to be practicing internal medicine, and what really interested you about the program?
Thank you for asking that. Yeah, so for me, internal medicine, how I was interested in it was I did my internal medicine rotation as a third-year student in Baltimore. And I fell in love with this field I love being in the hospital. I like that acuity of the broad spectrum of illnesses that you see, and then how you have to do detective work and incorporate the labs and imaging in the clinical setting of it to come to a diagnosis and to interact with patients and even help them out, even on discharge, what to do. I like how internal medicine encompasses both the inpatient side of things and also the outpatient, and having that clinical medicine as outpatient as like the longitudinal experience, which I also enjoy doing. So all these things really attracted me to this field. And my program here at the Brooklyn Hospital Center, being in downtown New York, I'm sure Gautham agrees, you see so much pathology and so much diversity and so many different types of patient populations. And seeing all that, seeing like such interesting cases, seeing different, like we see really sick patients over here too. So seeing that wide spectrum of things and having the consultant services, cardiology, gastroenterology, everyone, and learning from them, learning from the attendings, and every day is honestly a different adventure. And I'm very happy to be in this field.
So just another follow-up question there. As Dr. Gautham said, he also applied for surgery when he was looking at going into different areas of medicine. Were there other areas of medicine that interested you prior to selecting internal medicine?
Yeah, that's a great question. So when I was doing my internal medicine rotation, the core rotation, I watched my first endoscopy, and I was really interested in GI before going in. I'm a third-year internal medicine resident right now, and throughout the years, like first year I was going hardcore for GI, second year as well, and then third year, now I'm kind of thinking about just focusing my whole life, dedicating my career into just one specialty. I don't know if I'm that passionate about it just yet. I'm still kind of thinking about it, but I really do like the comprehensive side of how internal medicine deals with things. I'm also interested in geriatric medicine as well, so I'm thinking of doing that for a year before making a final decision if I want to continue as a hospitalist or pursue a career in gastroenterology.
Perfect. So, Dr. Gautham, what would you say were some of your most rewarding and challenging moments during your education in internal medicine?
Yeah. So again, that's a good question, and I can't put a finger down on how many I've had challenging situations. Like Shri was saying, yes, Brooklyn, especially where we are in Brooklyn, specifically East Brooklyn, is a very specific and honestly very sick population generally. So I think what comes to mind is, at least in my residency, we had a specific rotation, which was called CCM, which was basically critical care medicine. And we're basically the admitting service for the ICU. And pretty much there is no limit to how many patients, because we take care of everyone who doesn't fit and can't get them into the ICU. So I just remember being, we were admitting these sick patients from the ICU intubated, many complex medical issues. I was taking care of up to 15, 20 patients, sometimes with just me, maybe another one or two junior residents. But I just remember, like Shri saying, so that's where you really find out how you apply like all the medicine you learn. Because basically, you take care of floor patients or clinic, and you're taking care of just, diabetes in the outpatient setting, but suddenly you now have to take care of that with an infection while they're, being intubated and all that at once, and you put it all together. And I think that's where it really came together. And that was mainly during my third year in residency. So I think that was one of the challenges, which, I think I only was able to handle because of my residency in internal medicine.
And how would you say that these experiences have provided you with the education to become a better physician today?
Right, this is for me, so I take it. No, definitely. Look, even though I'm doing cardiology now, I think first and foremost, we're practicing medicine first. And I think that's something maybe in time some cardiologists lose a little bit of touch of. But honestly, whether it's in the patient in the CCU, I mean, where I was just there for the last couple months, it's all medicine. You have to know medicine in and out, and that's everything that's going on. The reality is, as cardiologists, we're not just focused on the heart. You're first an internist, and then you may be able to do some more advanced procedures or slightly more advanced treatments. But everything's based on medicine. So I think that's where I come from.
Dr. Shri, same question for you. What have been some of the most rewarding and challenging moments currently in internal medicine? And how do you think these experiences are going to help you become a better physician?
I think Gautham put it very nicely. For myself, I would have to agree with a lot of what he said. For my being in Brooklyn, COVID pandemic has definitely been one of the biggest challenges. Just in March and April, like we're like a small community hospital. We have like an 18-bed ICU. But at that time I think all the New York hospitals can say this, all the hospitals across America can say this, but we were definitely very overwhelmed in March, April, and we were one of the first cities to get affected. And it was truly a humbling experience. It went from like I'm not saying a lot about like the chronic illnesses that we have right now, but at least like you're confident about the treatment modalities that are out there. But with COVID, it was just brand new. We didn't know what we're dealing with. And I remember like our EDs were it was packed full. Like all the patients were lined up. First it was Plaquenil, like hydroxychloroquine, but that proved to be like harmful. So I think the whole experience of just dealing with the volume of patients and not knowing how to go about it and learning every day and teaching like each other of what the new guidelines are and discussing what the treatment modalities are and what we can do for the patients, even talking to the family members and seeing what their wishes are and dealing just with the magnitude of what this new pandemic came through. That was definitely one of the most challenging and most humbling things I've experienced. Some of the rewarding experiences that would be, I think, when a patient comes in with any of the acute illnesses like asthma exacerbation or COPD exacerbation or something that you're comfortable with, that you fixed, and that you can actually like discharge them with a good outpatient follow-up, as simple as it is, it's pretty rewarding. Or if there's any like challenging cases like that require a little more detective work, I diagnosed like an anterior cutaneous femoral nerve entrapment syndrome in clinic, which was rewarding as well. And honestly, all these things, I feel like the more you know that you have a lot more to learn. I feel like medicine is truly a humbling career. And I think having that aspect of it and being in this field, you're always learning. And I think that having that mindset allows you to be a better physician every day.
That is a perfect segue into one of our audience questions as well. So Dr. Shri, can you kind of expand on what does your typical like day-to-day look like, especially your hours as you're training in internal medicine, and how has that been impacted by the pandemic?
Sure. So right now, my day-to-day is honestly in New York, it's been pretty calm for the past few months until recently. Now our numbers are starting to pick up again. My day-to-day, so I'm in the ICU and CSU. So what I do is I help with the ICU admissions and I take care of the cardiac admissions with my second year residents. So typically I come in at 7 and then see if there's any pass on admissions from the ED. The ED calls us for admissions. We triage accordingly. We see the patients, delegate the tasks to the second years. If it's like a tough case, then I review it with my cardio fellow and my attending, or vice versa. If it's like an ICU admission, I'll review with my pulmonary critical fellow and the attending. And we recently had a COVID pneumonia case actually, but then the patient wished to be DNI, which means to not intubate. And so we are seeing a little bit more cases of COVID pneumonia, but COVID cases, but hopefully it doesn't rise too much like in March and April. And so yeah, keeping my fingers crossed. But and then usually my days from 7 to 7, it's 12-hour shifts right now. But internal medicine, you'll have like, depending on the programs, you'll have different rotations. So you'll have rotations in the floor versus ICU versus CSU, which is cardiac critical care unit. You'll even have like clinical rotations. It's a wide spectrum of what you can do in internal medicine residency.
Thank you. So Dr. Gautham, same question. How has the pandemic ultimately affected what you're doing in your cardiology fellowship, and what do your typical hours look like on a weekly basis?
Okay. Yeah, so the pandemic, it changed a lot of stuff. I guess just going back to when it really hit, which is, from February, March on, I'll tell you, everything changed. The reality is there's no distinction between all the types of medicine. They were just basically, we were all practicing medicine. Everyone was asked to basically cover the ICU. We did not have a CCU anymore. It just became an ICU. All of us were just rounding on patients and taking care of the critical patients. How it specifically impacted cardiology was also just the reality is, I don't know if people know, besides people coming with COVID, people just didn't come to the hospital for anything else, including heart attacks, MIs. So the volume in the cardiac catheterization lab declined a lot. So there are definitely changes. And honestly, like Sri was saying, how do you treat the patients is also up in question. No one knew. Do we give anticoagulation? Do we do the catheterization, cardiac cath in these patients? Because many of them didn't really have real blockages. So, things change right now. Basically, we're sort of back to where we were. Things are sort of coming back to normal outpatient practice cardiology. My day-to-day, it really depends. So right now as a fellow, we rotate between different specialties. So actually right now I'm on nuclear medicine, which is, I guess they say it's a little bit more laid back, but basically we're the one who do the stress tests on patients when we do the nuclear imaging for checking to see if they're having, any suggestion of having blockages or these kind of ischemic workup. But as I said, last couple months I was on the CCU. It depends. Normal hours now as a second year, about 9 to 5, 8 to 5. I do call, basically home call now a couple days a month, but it really depends. As a first year, we were doing 24-hour calls every 3 or 4 days. So it's busy, but but it's definitely worth it.
Perfect. And then a question for you both. We'll start with you, Dr. Shri. How would you say that your lifestyle matches or differs from what you envisioned when you chose to go into internal medicine?
For my lifestyle, I picked New York because I'm definitely a city girl. I like exploring. I like exploring all the food scene. I love to eat. So I like I fell in love with New York when I was doing rotations here, so I definitely knew I wanted to be here. In terms of lifestyle, as it is a New York hospital, and being a New York hospital, you see a lot, you do a lot, but you're also in the hospital a lot. So I was definitely expecting. We do work long hours, but it's definitely worth it with all the medicine that we get to see and learn. In terms of lifestyle, first year was definitely, as everyone says, the intern year is the hardest. Second year, we were a lot of our rotations are in the ICU or CSU, so that's also like 12 hours. But in third year, the senior life is great. Definitely have a lot more golden weekends. Golden weekend is basically when you have 2 days off. You're very in our rotation schedule, so we have that a lot more in third year. So I'm definitely trying to explore more of New York as much as I can. But this is just residency, so this doesn't attribute to how life will be in your internal medicine career. So hospitalist lifestyle is great. It's like 1 week on, 1 week off, depending on if you want to pursue a specialty or not. So that's what I would say about this.
I had never heard the term golden weekend, so good to know. I just view them as weekends, but definitely makes sense if you're not getting those back to back due to calls. So Dr. Gautham, would you say that being in cardiology, do you feel that your lifestyle matches with making that choice in that subspecialty, or is it a little bit different than what you envisioned?
No, it's not actually that different. I mean, fellowship, like residency, depending on your years, your schedule will differ. Again, like before, I'm saying my first year was very, very busy. My second year is much better. I get most golden weekends, if you want to say it like that. But even after cardiology, you can have the schedule or the lifestyle you want, and it depends on what you really want to do. You can practice primarily as outpatient, or you can do as inpatient and manage, whether it's a CCU or just a heart failure, and then there's also like intervention. So, so right now I'm actually applying for interventional cardiology, actually in, I don't know what's today, the 12th, 14th, something. It opens up in about 2 weeks for the applications for interventional. So that's what I'm going for. And yes, that is the lifestyle, which is a little bit not the one everyone, necessarily wants, which may be up at night doing the STEMI calls, which are basically when people come in and acute MIs overnight, you got to go in at any hour. So I'm enjoying it, but it's definitely, it can be the lifestyle you want, and then you can choose.
Perfect. So another question from the audience. Dr. Shri, what would you say is a typical day that you have in internal medicine, and what would be your favorite thing about practicing in internal medicine?
So that's a good question. So in terms of a typical day in internal medicine, so I'm going to talk about when I have floor rotations more so. So usually I like to come in around like 6 a.m. and pre-round on my patients. We'll get sign-outs at 7. And then after that, depending on when the attending likes to round, it's usually like 8 to 9. I like to see all my patients, lab work, imaging, console notes, all those things, get everything going. And then we usually round with the attendings, which is it's like an interdisciplinary team. So it's the attending, the pharmacists, the medical students, and the residents. We all talk about the cases and then go see the patients individually, spend time with the patients, and this way, to place emphasis on bedside manners, which is very important. And I feel like that's being lost. So we tried to instill that to our medical students as well. And right after rounds, we do our orders. This is Adrian, one of my colleagues, by the way. Sorry. So after rounds, we do our necessary orders for the patients, consult, writing our notes, which is one of the more annoying parts of internal medicine, I guess. And then after, so that's basically the afternoon, that's what it entails. And then you get to sign out at 4 p.m. And if you're on call, then our on-call schedules are till 8 p.m. and then the night team takes over. So that's a typical day for when you're on the floors in internal medicine residency. And sorry, what was your second part of the question? I think it was.
I think it was, what do you enjoy the most about medicine?
What do I enjoy the most about internal medicine? I love I would say I love being in the hospital. I love the acuity of it. Like I like the detective work of it. The figuring out like the labs, the imaging, how the patient presented, putting it all together to a diagnosis, trying to see what's best treatment modalities for the patient and how to prevent them from getting readmitted. I'm a huge fan of hospital medicine. I would say that's my favorite part. Thank you.
Perfect. So we've also noticed that studies have shown that in the next few years, internists are going to be more necessary and they're going to be needed more than are currently actually practicing. So what do you personally think needs to be done to cover the shortage that the AMA has predicted? Dr. Gautham, we'll start with you.
Oh, that's a big question. What are they gonna do? I mean, honestly, you have to train more doctors. I think there are programs which are now giving more, I don't know if necessarily incentive, or maybe they are incentives to go into primary care, or internal medicine, rather than some specific subspecialties. And, I think that's something which is being done, and it's known that, primary care is what's lacking. And I think, honestly, that's the majority of medicine, if not almost all of it, is primary care, and everything else is kind of just, very small portions which need to be addressed. So, honestly, I think what many specialties do, at least how they may be addressing it, is many specialties other than medicine, if you don't know, they rotate in medicine, whether it's surgery, whether it's psychiatry, even ophthalmology, dentistry, they all rotate through medicine. So, maybe something to do is, everyone needs a background in medicine. And actually, I think just like she was saying, in COVID, my friends who were radiologists were being asked to cover as hospitalists. So the reality is you can be called to do anything, and especially medicine, people were called. It doesn't matter what their specialty was. So I think everyone has to practice medicine, whatever specialty they go into.
So, Dr. Shri, do you think that this will impact you, especially since you're currently in training as far as being an internist? And do you think that you would probably start to encourage like your current colleagues as far as staying in internal medicine because of the fact that there could be more obviously job opportunities and just growth opportunities due to the fact that there could be a shortage?
Yeah, that's a very different question. So in terms of how I feel about it is, I feel like internal medicine, like Gautham said, I'm in complete agreement with whatever he said. Medicine is the foundation for everything. And in terms of job opportunities, yeah, we definitely, so this when I right? And then he was like, that means you haven't been inspired yet, or you haven't been you haven't been made to think about something so deeply that you fell in love with it. So I feel like I think one of the strategies to encourage people to go into internal medicine would be to have them, especially if our medical students are rounding with us or doing something. I think it's very important that you include them in your whole patient care and give them more responsibilities, and then educate them more, make them more involved in the whole aspect of patient care, because that's when you truly are diving deep into this matter, and that's when you will I feel like that's when you'll really know if you like it or you don't. And I think that's what it is. I think that's when if you inspire more people by teaching them and seeing your perspective on how your passion for internal medicine, it might inspire someone else. And I think that's why doing this live event, I'm hoping we can reach out to some more, future internal medicine applicants.
Perfect. Now, switching gears into like the future of internal medicine and ultimately subspecialties as well. Obviously, subspecialties are a big benefit when you choose internal medicine because most see internal medicine as being that stepping stone to different opportunities to subspecialize in those 13 different areas, including cardiovascular disease, endocrinology, hematology, infectious disease, etc. Dr. Gautham, in your opinion, what are some of the subspecialties that you think ultimately benefit from having this foundation in internal medicine?
Well, I mean, I guess if all these subspecialties follow medicine, I mean, they're all based in medicine. I mean, let me think. I mean, just cardiology. I mean, like I have clinic every week, and basically I'm just managing medicine, with some minor differences. I mean, actually, the thing is all the subspecialties that follow medicine, basically, I'm not even sure how to put it, but basically medicine is all these specialties are based upon. Pretty much everything when you learn in medicine, you practice all these subspecialties. So, when you're treating diabetes, you're treating CAD, meaning coronary artery disease, or you're treating an infection, you're practicing all these specialties. The only difference when you do any of these specialties is just, honestly, the reality is, I think when you're doing any of these specialties, when you're calling, let's say, for a specific evaluation from one of these specialties, you're just asking for the procedure or the license which they have to do something which you can't do. So pretty much all these specialties are fully dependent on medicine and them understanding exactly what these specialties are, because in the end, when you practice medicine, you're practicing all the specialties. So I think they're almost one and the same. There really isn't that much of a difference.
Perfect. So a follow-up question there. Of course, you decided to choose to go into cardiology and even said that you are now in a couple of weeks applying to even go further within that same subspecialty. What were certain elements that made you kind of lean towards that? I know you also discussed that you were looking at surgery as well, but what ultimately drew you into practicing cardiology, and how do you think that having that foundation in internal medicine helped you make that decision?
Yeah. So again, so even before starting medicine, I during medical school, when I got exposed, I did a lot of surgical rotations. I was really interested in, I really enjoyed doing the procedures as well as treating patients outside that. But so that's what led me, medicine was actually a good mix between both. Not saying surgeons don't practice medicine, but medicine also has a lot of procedures too. So it was a good point. Honestly, it wasn't that clear that I was going to do cardiology. I honestly enjoyed all the aspects of medicine. In the beginning, I thought I wanted to do gastroenterology too. I was doing some work in it. I mean, honestly, just saying, after a while, I think the exam, I got a little tired of doing a GI exam on every patient. So I enjoyed more the cardiology aspect. And the program where I was at for internal medicine, it's actually in Brooklyn too, it's Brookdale. They had a very busy cath lab, and specifically they were involved a lot with these procedures. Let's say one was not only coronary angiogram and like stenting and that kind, but also with these pulmonary embolisms and actually removing them. And this was done by cardiologists. So I got involved in some research with that, and I found it really interesting. And the one thing which, let's say for cardiology, which I don't know, not that many fields have something, it's the one thing where literally you see a patient and you can save the patient within half an hour. When you come and you take them to that cardiac cath lab and you open up the vessel, like immediately when they're on the table, chest pain goes away and they're alive. And that's the one thing that's keeping kind of going. And that's a little bit driving why I'm specifically also going into interventional cardiology.
Thank you. So Dr. Shri, I know we talked about a little bit about lifestyle and how you're drawn to New York. Were there other elements of the program that you're at now that ultimately made you kind of take that into consideration of when you're practicing internal medicine that made you lead towards one basically program versus another?
Yes. So definitely the New York was one of the greater reasons of why I ranked this program very high. But the other part is I liked how this program had a lot of in-house fellowships. So that means that it had cardiology, gastroenterology, pulmonary critical care, and hemonc, and it also just by I think people who are interviewing right now, and people who are going through this process right now, I think some of the advice that I would have to give is really feel out, see what you're interested in, and when you're in the interview, make sure you're asking a lot of questions about how their days are, what they're seeing, what you're specifically interested in. So for me at that point, I was going for gastroenterology. So for me, it was important for in-house gastroenterology fellowship. And the other part that I remember asking is what pathology, what kind of cases do they see, and how do they, and the balance of having autonomy versus attending supervision. Because then I also wanted to be exposed to a lot, and I also wanted to have my input, wanted to come up with a plan myself, but also have that supervision where I can discuss it and make sure I'm doing the right thing. The other thing that I learned about doing internal medicine residency here is that whatever you learn in the books is not how it portrays clinically. And I'm sure Gautham can agree with this too. So I think clinical experience and seeing patients and learning from the continuity of it, you learn so much. And so that was very important for me too. So those are the aspects that I was looking for when I ranked this program high.
Perfect. And stemming from that, we also have another question is, how do you kind of plan for after residency? What are the next steps that you take after you've gone through residency? Do you do a fellowship? Do you immediately go into practice? How does that process work? And what do you take into consideration? Dr. Shri, we'll start with you.
Okay, yeah, that's a great question. Because then I'm going through it right now, so I can definitely give you guys the answer for that. In terms of how I went about it, if you're really interested with a specialty, especially if it's competitive, like cardiology or gastroenterology or pulm crit or hemonc, I would suggest that you would find a mentor earlier on, first year, find a mentor that's in that field. You can even reach out to you can even email outside mentors that can help you get started on the research aspect of things, make connections, and things like that. But if you're not so sure about the subspecialty yet, I suggest that, doing more electives in what you're confused about. That really helped me figure out that, hey, I kind of like all of medicine rather than just one aspect of it. And the other thing that kind of helped me go more towards the geriatric medicine side of things was definitely COVID. I just felt in our population too was a lot of elderly population, and I was also always close to my grandparents growing up. So for me, geriatric medicine has so much to offer and it's very underrated. So that's why I want to explore that first and try to decide if I want to pursue further fellowships in a subspecialty afterwards. I think if you're going to pursue a subspecialty, it's 3 years, right? If it's gastroenterology or cardiology or anything like that. So you have to really make sure that you're passionate about it. You know for sure that you love that field and you want to be in that field. So I think that's one question that you have to ask yourself. So during residency, I would suggest doing electives, talking to mentors, and trying to make that decision. But if it's competitive fellowships, definitely making that decision earlier on is something that I would advise.
Dr. Gautham, any advice there as well as far as how you planned for post-residency?
So exactly like Shri was saying, definitely finding mentors is important. Honestly, just trying to narrow down, and I'll say whatever field, whatever it is, just get involved in some research, write case reports. Someone gastroenterology, well, maybe it would have helped if I went for GI, but those kind of things. And in the end, what you want is when you do apply for fellowship, you want people in that program in your field to vouch for you. In the end, your application is very important, but it's the people who are going to pick up the phone and call for you. So you got to have make strong connections. Another thing which helps, and it's something I did actually, was I did a 4th year or chief year actually at my program. So what that entailed is so something is like chief residence, which is something that goes on your resume and your application, but also gave me some, I also did partial hospitalist work. So it was a mix of both and a mix of like managing the residents and something. And this is something which is a really good experience and something which, I would definitely recommend, especially if you want to go into any more competitive subspecialty. It will definitely help to do something like that.
Perfect. And then we also wanted to basically have your advice when it comes to future internists. What are some skills that every physician in training should have for internal medicine, but they won't necessarily be tested for it on the actual board exam? Dr. Shri, we'll start with you.
Yeah, that's a great question. I think like just something that I touched upon before, I think the bedside manners, talking to patients, and the fact that like the clinical medicine, the medicine, like the theoretical medicine that you learn, it doesn't always apply clinically. And the questions that you see on board exams, what you actually practice in real life is it's different. It's not, I'm not saying it's completely different, but there's definitely a different art to it that you only get when you're, so I really highly suggest whoever's in their rotations right now, take ownership of your patient. And I really think you should follow them along and see what they came in with, what the labs were, what the doctors of the team they did, what orders they placed, and what happened. Like, see like throughout their hospital course what happened, what does medication do, what complications arose. Because I feel like with when you follow your patient, when you talk to them more, and I think the communication skills, like getting a really good history can make a huge difference. It can change from like one diagnosis to another. So I think that's something that even now, like I still think that I'm learning about every single day, of how to phrase certain questions to get more information. And I think that's very important that you're not going to get in board exams.
Dr. Gautham, same question. What are some skills that you feel that those that are studying in internal medicine should be prepared for that won't necessarily be on the boards?
Okay, one very important thing. You got to learn how to read an EKG. Honestly, in medicine, I'll tell you, in medical students, you should not be at all deterred when they ask you to read an EKG, because I'm telling you, most, if not all, half the residents don't know how to read an EKG. So the resident should, as a medical student, you should step up and learn. But honestly, it's like the basis of almost every patient who comes to medicine is you get an EKG and you get an X-ray, a chest X-ray. So both of those are very important. I don't really think they show up that much on the boards. I'm just thinking, or if they're the very simple ones would show up. So those are very important. And obviously, you practicing history taking, as a medical student, it's going to be like that big. It's your initial plan and your history. But by the end of it, if you're able to take a good history, that's how you really become a good practicing physician, when you can make a good, concise plan. And it's based on a good history.
Perfect. So another question that we have is, what is one question that physicians in training should be able to ask themselves before they actually pursue a career in internal medicine? Dr. Shri, we'll start with you.
That's a great question. So me and my friends have this debate. So some of my friends practice in family medicine in like the outpatient setting. And they're always like when they have to do like any like floor rotations, they hate it because they don't like the acuity of it. They like having that like preventative medicine and the chronic management of illnesses. So which internal medicine also entails of, like, you can always have like your outpatient medicine and have your own clinic. But then I think I would say one question that you should ask yourself is, how much do you love the thinking, the detective aspect of it, and then the comprehensive aspect that internal medicine entails? if you guys like that, then I would definitely suggest at least doing rotations or electives in internal medicine rotation, trying to see if you like it. Yeah.
Dr. Gautham, same question. What is the one question that you think any internist should ask themselves before they start to practice in that realm?
Honestly, not exactly sure what question. The one question they should be asking themselves. I mean, the obvious one is obviously if they're happy every time are they happy to go to work every day. That's an important thing. It's tough hours, especially residency, fellowship. Can they do this for the rest of their lives? Not that they have to get up at these hours, but would they? And I think if the answer is yes, then I think you should, it may be something that you should go forward with in medicine or any field.
Perfect. So thank you both. Now we are going to take some time to answer those questions from our audience. As a reminder, for those of you that are tuning in, just make sure that you type your questions in the comments below and we will go ahead and ask them. So the first thing that we have here is, how do you make patient referrals? Dr. Sri, we'll start with you.
In terms of patient referrals, like, do they mean like consults to specialties or like an outpatient setting and then you're referring to a different case setting? They probably can't answer that, right? So I'm going to assume patient referrals. So it would be, so if you're in the inpatient setting, if the patient is needing like consultant service, we usually just go with the consultants and ask them. And then if they, based on their advice, we can always set them up with the specialty clinic of their choice, depending on what insurance they have. And same thing as primary care clinics when you're as an outpatient, if they have a certain specialty that they want to see, we will reach out to them and then they can make appointments and so forth. I don't know if I answered the question properly. I don't know if that's what they meant. Please, if they clarify, please let me know. I would love to answer it properly.
Nope, that is perfect.
Okay.
We're good there. So, Dr. Gautham, what advice would you give to those in basic sciences on how to get to where you are today?
The basic sciences, that was a long time ago, I think. Honestly, basic sciences. So yeah, when you're going into the physiology, I think actually physiology is it's pretty much one of the most important things. But basically, it's just I think actually the studying habits. I'll tell you, when I was an undergrad, I didn't have such great studying habits all night. Be up reading. But when in medical school, I think if you set a certain amount of material to study every day, and do a set amount of questions, I think that's honestly the only way you can really keep up, because the amount of material it's never ending basically when you keep going. So I think if you budget your time, then you can keep building on the knowledge you have, and that will give you the base to do well in medicine and or any subspecialty.
Thank you. And of course, as we kind of discussed when we were introducing the topic in general, internists specialize in that diagnosis, treatment, and prevention of disease in adult patients. Of course, this means it is a wide variety of different health conditions, and you're obviously providing counsel, you're making those recommendations, and ultimately finding the best treatment for your patients. Since there are so many different things that unfortunately can go wrong, and there's just so many different things that fall under internal medicine, how do you find that confidence when you're starting to not only just be in residency, but when you're also practicing, to make sure that you're making those proper recommendations, knowing that everything is ultimately always changing? And how do you really feel like that you're being the best physician that you can? Dr. Sri, we'll start with you.
Wow, that was a beautiful question. Honestly, it's like I said before, medicine is definitely a humbling experience. What you can do is you have to trust in the system. So I think that's what I told myself before my first day of residency. I was like, you know what? We went through medical school, we did rotations, we got some experience. like we're always learning every day, but you have to trust the system that you came to where you are for a reason, and you have enough experience, and you have to be confident thinking like that. And honestly, residency really teaches you like how it gives you autonomy. You're handling such a wide range and huge number of patient load that you get to see like a lot of the common conditions, and you become more confident as you're treating them, and it becomes like second nature to you and those stuff. And if you come across a case that's more challenging, you have the support too. You have the specialists like Gautham and other, and other specialists that will give us their advice. And there's so much research that's ongoing. Like we're all learning, we're all teaching each other. So I feel like having that sense of teamwork and someone that you can always rely on, and asking for help when you need it, and just being confident in the knowledge that you have and trusting the system of how you got to where you are. I think that is what keeps me going, and I'm hoping that I'll learn more every day.
Perfect. So Dr. Gautham, in the same type of vein, obviously you've now moved on from doing your foundation in internal medicine to now you're in cardiology. How do you feel that having that foundation has helped you? But in the same vein, do you feel as though you fall back on some of the things that you've learned within that time that make you more confident as far as when you're giving your recommendations for cardiology? And how do you have that kind of internal strength to make those recommendations as you're starting to practice and learn more about cardiology?
Yeah, I mean, honestly, whenever I see a consult for cardiology, I look at the whole patient when we're treating. So I fall back very heavily on my internal medicine background to make an assessment. You have patients who come in with multiple medical problems. You're not sure, is this secondary to, is this from their heart? Is it from their lungs? Is it from their kidneys? What's the problem? And that's where you really use your medicine background to, use all the fine points, and you decide what's the best treatment. And it really changes the treatment. Whether they need antibiotics versus do they just need medications to get the fluid out. And how do I get the confidence? Honestly, it takes time, and you honestly should never be that confident. I'll tell you, when I was doing a hospitalist, when I was doing the chief year, I'll tell you the most frightening thing was the first day when you're like, do I discharge this patient? All the residents are with you, and they're just like, discuss with the attending, and you have to sign, and you're just like, I don't know, this patient has asthma, she looks okay, but should I send her home? And that's where you gain a level of comfort. And honestly, what I did is rely very heavily on my other, who were my attendings before, but now they're my colleagues. And you ask them cases, because honestly, at the end of residency, I'm far from knowing all these medical problems. So I rely heavily on others. And you, as intending or any level, ask others for what they think, and they will help you. And that's how you gain confidence.
Perfect. And one final question for you both. What everybody wants to know is, how was your experience at AUA? Dr. Shri, we'll start with you.
Honestly, my experience was great. I did 2 years in Manipal. So I got to travel a lot with AUA. So that 2 years in Manipal was great, being in a different country, experiencing the teachers, like how they teach over there and their medical knowledge. That was interesting perspective. And also being in Antigua, they really pushed you, and then it was more of they knew like what the boards were gonna, like what step 1, step 2, like how that was going to be like. So they definitely pushed you, to studying more and in a more directed approach, which helped me with my scores. And after that, even clinical rotations, they have they have a lot of sites at different hospitals. I got to, I did my rotations everywhere, like Louisiana, Baltimore, New York, Georgia. Like I was everywhere thanks to AUA. And I got to experience so many different hospital systems. I even got to do electives in India as a 4th year, and I got to see like a lot of, like I did like infectious disease and internal medicine, and I got to see different hospital care systems in in different countries, and all the attendings were super sweet. I'm sorry, all the teachers, all the professors, they taught a lot, and it was a great experience. It was very supportive.
And Dr. Gautham, your experience?
Yeah, so AUA, I actually also went to Manipal, and I did my basic sciences there. I think it's a little earlier, so I did my entire basic sciences there. It was actually, that was the reason I chose partially the program or the school, was because, I had family who was actually from Manipal, so I actually stayed at home. I got to stay with my grandparents. Other than that, the school was, very well known, not just Manipal University, but Antigua as well. So I had a great, 2 years there. Coming back here, I had, very strong clinical rotations. Actually funny, one of my, I did some of the cardiology electives here in Brooklyn, and now the attending, actually, I'm just thinking he's the same one who now I'm working with. He's like, now when I was a medical student, now I'm working with him as a cardiology fellow. So, AUA gave a great foundation, knowledge, but there's no difference. Even some of my other co-fellows are also from AUA in cardiology and in residency. So, I had a great experience, and I definitely had a very, very good education.
Perfect. Well, thank you again to both our panelists for providing your very keen advice as well as your experience, so everyone that was tuning in has a better understanding of how you can become an internist, or you can use it as a stepping stone to a future subspecialty within your career. And make sure for all of you that are tuning in to follow AUA's social channels, where we will be posting a poll to vote on for next month's roundtable, which will be on December 16th. So we will see you next time. Thanks so much for tuning in.